In this video, we are going to learn everything you need to know about the coronary arteries. By the end of this video, you will understand where each coronary artery travels and its branches, what they supply, coronary dominance, common anatomical variants, and STEMI location and its specific ECG changes. The coronary arteries supply oxygenated blood to the heart muscles. There are two major vessels. The left coronary artery arising from the left aortic sinus and the right coronary artery arising from the right aortic sinus. The left coronary artery after 2 cm divides into left anterior descending artery, also called the anterior interventricular artery, and the left circumflex artery. The left anterior descending artery runs through the anterior interventricular sulcus towards the apex of the heart. The major branches are diagonal branch and interventricular septal branches. Lead supplies the anterior wall of the left ventricle, anterior 2/3 of interventricular sulcus, small part of right ventricle adjacent to the anterior interventricular sulcus, and the cardiac apex. Lead is the most commonly occluded artery and is often referred to as widowmaker because of its association with high mortality. As lead supplies the anterior part of the heart, occlusion of lead is associated with anterior STEMI, and in ECG you may see ST elevation in V1 to V4 leads. The next is the left circumflex artery going through the coronary sulcus. It gives off left marginal artery and several atrial branches. Finally, it becomes the left posterior ventricular branch. It supplies the lateral wall of the left ventricle, left atrium, and SA node in 40% of population. Left circumflex artery occlusion leads to lateral STEMI, and in ECG you may see ST elevation in 1, AVL, V5 and V6 leads. The right coronary artery travels through the coronary sulcus to the inferior surface of the heart. It gives off sinoatrial nodal artery, supplying the SA node in 60% of population. Cornal branches supplying the conus arteriosus of right ventricle. Atrial branches which supplies the right atrium. Arterioventricular nodal artery which supplies AV node in 80% of population. Right marginal artery supplying the lateral right ventricle. And finally, the posterior descending artery, also called the inferior interventricular artery. This is the terminal branch of right coronary artery. It supplies posterior 1/3 of interventricular sulcus and posterior inferior surface of the heart. RCA occlusion therefore causes inferior STEMI. In ECG, ST elevation can be seen in 2nd, 3rd and AVF leads, and as it supplies the AV node, RCA block may also lead to heart block. Coronary dominance is defined by which artery gives rise to posterior descending artery. In 60 to 80% of population, the right coronary artery gives off posterior descending artery. They are said to have right heart dominance. In only 5 to 10% of population, the left circumflex artery gives off the posterior descending artery, and they are said to have left heart dominance. If both left circumflex artery and right coronary artery gives off the posterior descending artery, it is called codominance. This happens in 10 to 20% of population. In summary, lead occlusion leads to anterior wall MI, so you may see ST elevation in anterior leads, that is V1 to V4. RCA occlusion leads to inferior wall MI, therefore you may see ST elevation in inferior leads. that is 2, 3 and AVF. Left circumflex occlusion leads to lateral wall MI, so ST elevation in lead 1, AVL, V5 and V6.